Disease of the Day by Kelly and Alex. Scenario: while taking a vacation in the Caribbean, we decided to visit a small open market where we see a 4-year-old girl that appears to be ill. She complains about having a sore throat and a fever for a few days now. We decided to take a closer look at her and saw that her throat appears to be covered with a fuzzy, dark gray coating.
Some possible diagnoses for this girl's illness could be strep throat or diphtheria. Strep throat and diphtheria both involve having a fever and a sore throat. However, strep throat's tonsils are colored red and has white spots around it, while diphtheria's tonsils are covered in a gray dark coating.
A test used to detect diphtheria are a swabbing of the back of the throat, nose, and any mucous membrane. Doctors will also do a biopsy of any recent skin lesions that could have formed due to the cause of the disease.
Diphtherium is an infection caused by Corynebacterium diphtheriae bacterium and it is transmitted from person to person through respiratory droplets. For example, coughing or sneezing. It constantly multiplies on or near the surface of the mucous membranes of the throat, and it can also be transmitted through coming in contact with any object that has bacteria on it. If not treated quickly, one is soon to develop breathing problems, heart damage, and nerve damage.
Some treatments include an antitoxin. If doctors suspect diphtheria, the infected child or adult receives an antitoxin. This is injected to a vein or muscle and neutralizes the diphtheria toxin already circulating in the body. Another cure would be antibiotics. Diphtheria is also treated with antibiotics such as penicillin or erythromycin. Antibiotics help kill the bacteria in the body, cleaning up infections. Antibiotics reduce to just a few days the length of time that a person with diphtheria is contagious. Doctors usually keep diphtheria patients in isolation until they are no longer contagious. This usually takes about 48 hours starting antibiotics. After the patient finishes the antibiotic, the doctor will run tests to make sure the bacteria are not in the patient's body anymore.
Some prevention measurements that you could take are by getting vaccinated at a young age and continue on with booster shots. Also, if you live in sanitary conditions, this will keep diphtheria from forming. While also, when traveling outside the U.S., you need to take cautions of if diphtheria is a contagious bacteria or disease inside that country that you're visiting.